The Institute of Hospice and Palliative Care in Africa is the education arm of Hospice Africa Uganda, which was established over 31 years ago by Professor Anne Merriman, who had a vision to spread palliative care throughout the continent of Africa. Since it started delivering learning programs in palliative care in 2003, the Institute of Hospice and Palliative Care in Africa has trained hundreds of doctors, nurses and healthcare professionals at different levels. The Institute of Hospice and Palliative Care in Africa offers a 3-year bachelor's program in palliative care, a 2-year master's, a diploma and other short courses.
We were just hoping for this day, but that God has made it available to us. We are so thankful.
The academic registrar at the Institute of Hospice and Palliative Care in Africa, Dr. Nasur Buyinza, in his opening remarks, congratulated the students on their success, describing the graduation as a landmark day in the journey to see palliative care integrated in all health systems in Africa.
This program, or these two programs, fall under the College of Health Sciences, School of Medicine. But we are among the departments that produce the biggest number, or that have produced the biggest number of graduate students. And we are happy about that. Palliative care is growing. And that is a clear demonstration that it's growing.
Hospice Africa Uganda Executive Director Prosi Nachanja noted that training and educating healthcare workers from over Africa is the way palliative care will eventually be embedded in all healthcare systems, and appreciated those that supported the graduates.
We all know that training and education is one of the ways in which we can embed palliative care in our health services across Africa. And for the Institute to take on this role and continue educating these students, it will go a long way, and it goes a long way into ensuring that palliative care will be embedded into our health services and systems across Africa.
Different dignitaries, including the Institute's principal, expressed gratitude towards the graduates, but also raising some of the challenges, which include deploying the palliative care professionals to roles they did not specialize in.
You can do a change, go back and be a special person as you await for other promotions. The master's students here, you are advocates at national level. Face the policy makers and advocate for palliative care.
You are now ambassadors of palliative care in Africa. Go to your regions and tell people why their children can do this program, how they can benefit, and how people have to make money when they do a job. They will make money, okay? We have many elderly people out there who are in their homes who appreciate someone going to them and talking to them candidly.
The service that HAU offers is critical to our country, to our community, both in the immediate and even long term. And you are an essential component of that service. It is specialized, it has a call on it, it's a place of compassion and being sold out. So it's important that we have more of you to look after all these many, many people that desperately need care.
The problem is, most of these are nurses, but when they are redeployed after training, they are taken to theater, to community, to outpatient, not in palliative care. We would beg and ask that they be deployed to offer, to initiate, or to support palliative care services in the various health facilities across the country.
The founder of Hospice Africa Uganda, Dr. Anne Merriman, encouraged the graduates to head out and fully practice palliative care since they are well trained.
Economies are different, and that's why you have, they said in lower middle income countries that there is at least 50% of the population who are below the poverty line. So, these are the people that really need your help. Everybody needs your help.
The Commissioner for Nursing and Midwifery at the Ministry of Health was the chief guest, and while giving her address, she noted that the country had for long not given priority to palliative care, but the rise of non-communicable diseases has shown the purpose of strengthening the sector. She vows on behalf of government to fully support palliative care initiatives.
Why palliative care is very important. As a country, we have joined other countries, this time not in a good note, but in a bad note,
of increase in non-communicable diseases. We have taken up non-communicable diseases as one of the key areas now to address. And this still brings the palliative care package as one of the very important packages which we should be able to improve in order to improve life of people who are suffering and who cannot help themselves.